Good morning, everyone, for those popping in. We're just admitting folks, so stay tuned. We'll get underway shortly. Thanks, everyone, for being here. I'm just scrolling through everyone who's joining us. Really nice to see some familiar names. Thank you so much for tuning in today. I'm just going to look to my tech team to give me a thumbs up when it's good to get underway, because I know we have a jam-packed hour and I don't want to keep any of our participants from our exciting content today. Great, thank you. So I got the thumbs up. We are going to get started. Thanks everyone for joining us. My name is Nicole Clarke. I am our Acting Executive Director at HelpAge Canada. And in honor of the International Day of Older Persons, which took place on October 1st, and Ageism Awareness, which took place on October 9th, we are thrilled to host this webinar on confronting ageism and fostering inclusivity. It's a pleasure for me to be with you today and moderating this webinar. So to begin, I think we should begin with a definition of ageism. It can be defined as the stereotypes, so how we think, prejudice, how we feel, and discrimination, how we act, towards others or oneself based on age. At HelpAge Canada, we have a vision of a world where all older persons can lead secure, healthy, active, and dignified lives. And as we'll hear today, there are many negative health, social, societal, and economic impacts because of ageism. I understand that globally, 1 in 2 people may be ageist against older adults. So us at HelpAge Canada, we do not feel that we can work towards our vision without also striving to combat ageism. So today, thanks to this powerhouse group of subject matter experts, we will explore the effects of ageism through the lens of those who've experienced it, and discuss what we can do to foster inclusivity at every age. For those joining us today, you'll have the opportunity to pose questions to our panelists in the second half of this webinar. And it is a webinar, so your cameras and microphones are automatically muted. Please use the chat to engage with us over the next hour. There are several members of our team who will be monitoring the chat and responding to your questions and comments. I'd also like to share a brief land acknowledgement before getting underway. At HelpAge Canada, we acknowledge that our work brings us to the treaty lands and territories of numerous and diverse Indigenous nations, to whom we pay respect, and to all Indigenous peoples across Canada. I personally am speaking to you today from the traditional and unceded territories of the Anishinaabe Algonquin Nation. Now, please allow me to introduce you to our speakers today. I'll be introducing them in the order that you're meeting them, and we'll dive right into things. So first we have Dr. Olive Bryanton, an educator and a passionate advocate for older adults. Olive was instrumental in the establishment of the first multi-purpose senior center on Prince Edward Island. She was also instrumental in establishing the Seniors College, affiliated with the University of Prince Edward Island, and also served as the first president of this college. Her many awards include the Queen Diamond Medal for her contributions to seniors provincially and federally. And in 2017, Olive was appointed by the Minister of Health of Prince Edward Island to serve as an executive advisor for the development of the recent Seniors Health and Wellness Strategy for Prince Edward Island. She is a lifelong learner and defended her PhD in 2018. Thank you so much for being with us today, Olive. If you'd like to give a wave. I'm going to step through other speakers and then we'll move right into things. Dr. Laura Kadowaki is a research and knowledge mobilization specialist at the United Way of British Columbia. Through her work with Raising the Profile Project, she has been collaborating with the community-based senior services sector in BC since 2016 to do just that, raise the profile of frontline organizations supporting aging in place. Laura's background in gerontology and graduated with a PhD from Simon Fraser University in 2020. She's also an adjunct professor in the Department of Gerontology at SFU and a member of the Canadian Coalition Against Ageism. Welcome, Laura. Thank you for being up early on the West Coast joining us today. Then we'll have Alyssa Brierley, if you want to give a wave, who is currently serving as the Executive Director of the National Institute on Aging. Most recently, the Executive Director at the Centre for Equality, Rights and Accommodation, Canada's leading profit organization focused on advancing the right to housing. Over her 4 years in the post, she led the organization through a significant period of growth and national expansion. Alyssa is a lawyer, public policy professional with more than a decade of experience in public policy, legal service, and operations management. She holds a master's degree in political science from York University, a Juris Doctor from the Osgoode Hall Law School, and a certificate in nonprofit management from George Brown. Thanks for being here, Alyssa. Dr. Kiran Rabheru is a professor of psychiatry at the University of Ottawa and a geriatric psychiatrist at the Ottawa Hospital. He obtained his MD from the University of Western Ontario and is designated as a founder of the subspecialty of geriatric psychiatry by the Royal College of Physicians and Surgeons of Canada. Dr. Rabheru is a recipient of the Outstanding Achievements in Geriatric Psychiatry in Canada Award and is passionately committed to serving older persons and creating a world in which they can live free from discrimination. Among his many roles, he is currently the board of the International Longevity Centre and the Canadian Coalition Against Ageism. And last but certainly not least, I want to welcome Dr. Paula Rochon, who is a geriatrician and is one of the leading Canadian health services researchers in geriatric medicine. Her work has contributed substantially to 3 areas of focus: the need for evidence to provide information that is more relevant to women and men, the exploration of strategies to reduce adverse drug events and to optimize drug therapy, and the impact of widespread use of antipsychotic therapy in older people. With a strong record of funding from federal funding agencies, she has more than 200 published papers in peer-reviewed journals, and in 2015, Dr. Rochon was appointed as the inaugural chair in geriatric medicine at the University of Toronto, Retired Teachers of Ontario chair in geriatric medicine at the University of Toronto. Thank you all in advance to our speakers who are with us today, and thank you all for the time for these introductions. As I said, it's a house group, and we're so lucky to have them with us. So we are going to dive right in now. We'll begin with some stage setting by Dr. Bryanton and Dr. Kadowaki, who will share more about the implications of ageism, some of the insights from national consultations on this topic. We'll then move on to our panelists' remark. And during the second half of this webinar, our 3 panelists, Dr. Rochon, Dr. Rabheru, and Ms. Brierley will engage on questions from both our team and the audience. So over to you, Olive, to kick us off today. Thank you.
Thank you very much, Nicole. And this being an international webinar, it's good morning, good afternoon, and good evening to everyone. I am thrilled to welcome you to today's webinar, Confronting Ageism and Fostering Inclusivity in All Places. My name is Olive Bryanton, and I am from the province of Prince Edward Island, located on the east coast of Canada. As someone who has navigated the complexities of aging, I know firsthand the subtle and overt ways ageism can impact our lives and our communities. Nicole has already provided a definition of ageism, which is certainly how we think, how we feel, and how we act toward others based on age. But ageism isn't just about negative stereotypes, prejudice, and discriminations. It manifests itself in systematic barriers that creates limited opportunities for older individuals and creates an environment where our wisdom, experience, and contributions are undervalued. But these interpretations do not affect only older people. They impact all ages and society in general. So some of the implications of ageism is social exclusion, causing older people to feel isolated and disconnected from society, their families, and communities. There are also ageism often results in discrimination in the workplace, limiting job opportunities for older individuals. Healthcare access and treatment. Stereotypes about aging can affect how healthcare providers treat older patients, leading to inadequate care, misdiagnosis, or undertreatment of health issues. Ageism also impacts on self-esteem and identity. Older people can internalize ageism, and that is harmful because it makes them feel less capable or valuable, and which can further perpetuate the feeling of inadequacy. Ageism attitudes can influence policy, leading to insufficient support for services and programs that benefit older adults. Ageism impacts on intergenerational. It can cause tension. It can create divisions between generations. It's fostering misunderstanding and resentment instead of collaboration and mutual respect. By undervaluing the skills and experience of older individuals, society misses out on the potential contribution they make in various fields, including mentorship, volunteer work, and community leadership. By fostering inclusivity, we can create spaces where all ages are respected and valued, and advocate for policies that promote equity, dignity for everyone, regardless of age or place. I encourage each of you to engage actively in today's discussions. Your perspectives are vital as we work toward a more inclusive future. Thank you for being here, and let's get started.
Olive, thank you for those beautiful and powerful opening remarks that really contextualize a definition, and for the encouragement for everyone's participation today. Thank you. With that, Laura, I'm going to turn it over to you. I understand you'll be sharing some insights from National Ageism consultations. Thank you so much.
Yeah, thank you. And I'll set up my slides, so just bear with me for a moment while I share my screen. Okay, so hopefully everyone can see this. So my name's Laura Kadowaki, and I'm very happy to be able to join you today to speak about some national consultations that took place in Canada in 2022. And these were consultations that were held by the federal, provincial, and territorial ministers responsible for seniors. And myself and some colleagues from United Way BC were contracted to work on the toolkit for these consultations, as well as compile the What We Heard report with the findings. So these consultations were held in order to seek feedback from Canadians to better understand the impacts of ageism, and they were specifically focused on ageism towards older persons. And there were 5 themes that they decided they wanted to focus on, and these were employment, health and healthcare, social inclusion, safety and security, and media and social media. Now, people could participate in these consultations in 2 different ways. There was discussions that you could participate in roundtable consultations or stakeholder-led consultations, and there were about 25 of these held across Canada. And there was also an ageism questionnaire, which we had 2,920 responses to. And people could participate in both French or English. Now, I should note a couple limitations of the consultation methods. One was that the questionnaire was a publicly available survey, so anyone could participate, and therefore it didn't generate a nationally representative sample. And then also the feedback from the consultations and questionnaire was predominantly collected virtually, and that obviously was primarily due to the COVID-19 pandemic and lingering concerns about COVID. But that did mean, of course, that some people potentially were not able to participate if they didn't have access to a computer or the internet. So those are just a few limitations. Now I'm going to provide a few very high-level highlights from the consultations and questionnaire, just to give you a flavor for what people in Canada feel are their concerns and priorities around ageism. Of course, the report is quite long, so I'll share the link to it afterwards in the chat, and you can see all the details there. But I just wanted to give some snippets to give you an idea of some of the key themes and findings that came out from the consultations. So to start off with, in the questionnaire, we did ask people if they'd ever experienced ageism themselves. Now, both older people and younger people could respond to the questionnaire, but the majority of respondents were older persons. And we did find that about half of them said that they had experienced ageism. We also asked if stereotypes or negative views about aging had ever negatively influenced a person's perception of themselves, and we saw that about 40% said yes, it had. Now, specific to the theme areas, I'm going to highlight some of the findings in 3 of the theme areas. So the first one, ageism and employment. So in the consultations and also the open-ended feedback in the questionnaire, we got a lot of feedback about this topic and a lot of concerns about ageism that does exist in workplaces and in employers. And so some of the common concerns that were raised were, for example, stereotypical beliefs about older workers that hiring managers or coworkers might hold. So, for example, believing that an older worker isn't as productive as a younger worker. There were a lot of comments and feedback about discriminatory policies and practices that companies might have officially or unofficially. For example, there were concerns about hiring practices and the fact that some companies don't want to hire older workers and so would try and weed them out in the application process or not give them the job even though they're fully qualified. There were a lot of personal examples shared of older adults being fired, laid off, or forced to retire. And so you can see a quote here from a participant talking about their company, where actually the managers were incentivized to try and get rid of older workers and make them quit by creating a very toxic work environment. So there were a lot of stories, unfortunately, like this, where people talked about that discrimination. And then we also heard about people feeling pressures to retire due to the societal expectations that people retire at 65, as well as kind of just subtle comments or things people might be saying to them. For example, somebody asking them, "Oh, when do you think you're going to retire?" And sometimes that would be done quite repetitively, and people would get quite tired and feel a bit pressured, like, "Oh, should I be retiring?" Now, in the theme area of health and healthcare, there was a lot of comments and feedback as well. I think ageism in employment and healthcare generated some of the most significant discussion. And we did hear a lot, particularly in the questionnaire, of examples of older adults being denied care or provided with poor care. And the perception was that if the person had been younger, they would have received better care or different care. And so you can see a comment here from a participant talking about her mother-in-law and the fact that the nurse didn't see her as a priority and said that it wasn't her job to care for dying patients. She wanted to focus on people who could get better. And there were a lot of examples and heartbreaking stories, frankly, of people feeling that they had been discriminated against or hadn't been able to get that proper quality care for themselves or their loved one. There were also a lot of comments about healthcare providers making assumptions that a person's symptoms are simply just due to age. There was feedback about ageist attitudes or practices by healthcare providers and systems. And there were also comments and feedback from participants about what they saw as systemic issues within the healthcare system that they attributed ageism as being a root cause of. So, for example, there was comments and feedback around the systemic neglect of long-term care and home care, and the fact that these systems are underfunded, they don't have enough healthcare personnel. We saw what happened in long-term care facilities during COVID-19. And ageism and the fact we don't value older persons and their care as much was seen as contributing to these deficits in the system. Then the final theme area that I briefly wanted to highlight was social inclusion. And so in the comments from the consultations and questionnaire, it was highlighted that it's not just age as a part of your identity that can lead to people being included or excluded or discriminated against, but there's other intersecting forms of prejudice and discrimination as well, such as sexism or racism, which are going to shape your experiences. There were also a lot of comments about the digital divide and how older persons might potentially be excluded from online activities and communications. And this was particularly a concern with COVID-19 and everything moving online. There were comments about the lack of accessible and inclusive community spaces and activities for older persons. And you can see here a comment from somebody about their local community center and how they didn't have any programming for seniors. There also were comments about the lack of financial security for older Canadians and how that impacts their ability to participate socially. And it was seen that we have some obvious deficits or weaknesses regarding our retirement income system, and the benefits can't really provide people with the quality of life they need. And this was linked to ageism and the fact that we aren't properly prioritizing providing the financial security to older Canadians. Now, in the questionnaire, we did ask participants what they saw as being the most important theme area to address ageism in, and overwhelmingly, they selected health and healthcare. And then finally, to wrap up the presentation, I just want to highlight some of the strategies that people in the consultations and questionnaires proposed to address ageism in Canada. And people had a lot of different ideas, examples of programs, organizations, and suggestions for what could be done. And so at a very high level, trying to categorize and give some form to these suggestions, some of the key ideas that emerged include that we need to be implementing education and awareness around celebrating aging and also around ageism awareness, that we need to build intergenerational connections between older and younger generations, that we should be addressing the digital divide by offering, for example, digital technology training to older persons. It was recognized that there's a lot of nonprofit and community-based organizations that offer important programming to support older persons to participate socially, to help their health and well-being, to promote intergenerational connections, and in a variety of areas. And we need to properly fund and support these organizations. There also were comments specifically about the need to prevent the isolation of older adults and reach out to those people who might be at risk of being socially isolated. And then finally, we also had people talk about the need to make larger systemic and structural changes to how we care for people later in life, including developing more aging in place supports, innovative housing models, and reforming our healthcare system to modernize it so it can better meet the healthcare needs of older persons. So in the suggestions for strategies, there was that recognition of the need to address ageism that might be occurring at the interpersonal or self-directed level, but also for strategies that can address those larger systemic issues that ageism was seen as being a root cause of. All right, and so that's a very quick summary of the findings of the consultations. As I mentioned, you can find the full report all online, and I will share the link in the chat, but happy to just give you some of the very high-level context about what some of the key concerns around ageism Canadians have. All right, well, thank you very much. That's my presentation. And I'll stop my share.
Thanks so much, Laura, for picking up so nicely on Olive's opening remarks and supporting them with some really telling data about the state of ageism in Canada today, and for sharing practical strategies with us. I think that's always a wonderful addition to any data. We are going to continue right along with remarks from panelists. Alyssa, I'm going to turn it over to you to continue the conversation now.
Thanks, Nicole. And it was really great hearing, Laura, the results of the consultations, because it mirrors a lot of what we've been finding in our survey as well. So I'll try not to repeat too much for folks. But just off the top, at the NIA, we're tracking perspectives and experiences of older adults in Canada over a 10-year period through an annual survey that we're conducting in partnership with the Environics Institute for Survey Research. That survey is conducted online with a representative sample of almost 6,000 Canadians aged 50 and older across 10 provinces and living predominantly in the community, so not in institutional settings such as long-term care homes. The survey is stratified by region, educational attainment, and age, and it's weighted so that the national results are proportionate to the country's population based on the 2021 census. So in 2023, we asked respondents if they had experienced discrimination or unfair treatment because of their age, and 32% said that they had, and 64% that they had not. That sound like it lines up with the consultations, Laura, but when we asked them the question in a slightly different way and asked them if they had experienced what we call everyday experiences of ageism, so things like hearing, seeing, or reading jokes about old age, aging, and older people, encountering things that suggest that older adults are unattractive or undesirable, people insisting on helping them with things that they can do on their own, assumptions about people's ability to hear or see things or remember things, or their ability to use technology, things like that. When we asked about people's experiences with that, the number rose to 71% of people experiencing those forms of everyday ageism in the past 12 months. So that tells us a few things. First of all, people may not identify as having experienced discrimination or unfair treatment, but there is clear evidence that many older adults are encountering bias or discrimination in their day-to-day lives. They may not perceive it as discrimination because they may not feel that it's as concrete as something like being passed over for a job or being denied care, but these experiences we know are in fact harmful, as Olive was discussing earlier. Secondly, older adults may not be able to identify and name what ageism looks like in practice, but when specific prompts and specific questions are asked, it leads to a much higher reported rate of ageism. And I will say, just kind of in general, when it comes to discrimination, this the tendency to not identify something that one is experiencing as discrimination is common across many forms of discrimination. So it's not just unique to experiences of ageism per se. And then third, of course, just looking at the numbers that I've reported and that Laura spoke to earlier, ageism against older adults is quite rampant in Canada, and it's a real problem that needs to be solved. So I'll leave it there and pass it back to you, Nicole.
Thanks, Alyssa. I think of everyday ageism when I'm in the birthday card aisle at Shoppers Drug Mart. So thank you for reminding us what everyday ageism can look like. Kiran, let me get over to you. I know that you'll share a little bit more about what this looks like in a healthcare and education setting. Sorry, Kiran, you're on mute.
Thank you so much, Nicole and Raza and your wonderful organization for setting up this webinar. I just want to start by sharing a couple of personal stories. I grew up and I was sensitized to the whole concept of ageism by my grandmother, who used to say that when people get older, they're generally society feels that they can be put out on the curbside or pickup. And so I grew up with that idea, but didn't really know what it felt like until I started to practice in a healthcare setting, and which I've done for over 40 years now as a family doctor and a geriatric specialist, and my subspecialty is mental health, as you know. But and I've seen egregious violations of human rights and ageism over the course of 40 years individually. So for the past 10 years, we've been concentrating through the International Longevity Center of Canada that I chair the board of, and I work with my partner in crime, Margaret Gillis. And we've been trying to do something about human rights and ageism. But the ageism piece didn't come into focus for me until the World Health Organization report came out in March of 2021. And, it really made me think about what is underlying ageism, like what is the root cause? And we know that if you go back to 1800, the average lifespan was about, I'd say 30, give or take. In 1900, it was 40, but now in 2000, it's 70. So people are living so much longer. So we've added a lot of years to their lives, but not life to their years. And people honestly are confused. They don't really know what to do as we age. People's perception of old age is very heterogeneous. Some people say everyone gets old, but the process is subtle, complex as one's capacity and needs and desires change. Someone said it's a foreign country with an unknown language to the young and even to the middle-aged. Someone else said fears of ill health, loss of independence, finances, and intimacy. And myths and misperceptions all fill the vacuum when you don't really understand what aging is about. So when the global report was published, it showed clearly from the WHO that ageism is very prevalent, and Olive and others have talked about this. Not only is it prevalent in at least 50% of people, but it has serious consequences on people's health and the economy, major issues. And interestingly, one of the worst things to tackle in ageism is the self-ageism part, where people are ageist against themselves. The institutional and interpersonal ageism, which are the other two forms, are easier to tackle because they are visible and you can somehow measure them. So what we did 2 years ago, the ILC Canada oversees the Canadian Coalition Against Ageism. So we formed a national coalition with major partners to really try and do something about this. And CCAA is a social change campaign to transform the policies, practices, and the power dynamics, including social norms and the mindsets of people to look for a vision. Our vision is a Canada free of ageism against older people. But to establish this, we need a common agenda. We need a reliable network of active and committed organizational partners, as well as every individual in Canada. And I encourage each of you, every single organization and individuals, to please join us on the CCAA. We'll put up a link in a few minutes if you don't mind, taking a few minutes to sign up for that. I want to focus on what we're doing, and we can come back to some of these points. There are at least 16 different ways that ageism portrays itself, phenotypically expresses itself, and perhaps we can come back to that in the questions. So what we did through Laura Kadowaki, who is, again, another partner in crime, we were very happy. Supported us in terms of giving us a small grant to have a one-day forum, which we had on June the 5th. And we really mapped out, with the help of 75 people who came from all over the country, many of them came on their own dime, to look for researchers, healthcare professionals, community organizations, and older people. Olive was there as well. And through this group of 75 people, we came up with some educational and research and policy priorities on the short, medium, and long term. And what sort of bubbled up are some of the issues that I want to just quickly touch upon. Firstly, that older persons need to be part of this research plan that we're talking about. Secondly, we need to embed ageism education in healthcare training and professional training. Third, to promote positive outlines of frames of aging and to support intergenerational work. And finally, we need partners and funding opportunities to support this work, and really focusing on healthcare, the workplace, as well as developing positive reframing of aging, so that people don't see aging as a negative stereotype, but really to look for ways to promote healthy aging. And lastly, I want to tell you we just got these results similar to some of the surveys that have been reported before. We've just finished conducting an Ipsos survey of over 1,000 Canadians over the age of 25. And it's very interesting to see that there's still people are confused about what aging and ageism truly is. Over 50% of Canadians feel that they have a good understanding of the word, and 62% can actually identify ageism when presented with the definition. But this indicates that a significant percentage of people don't have a full grasp of the concept. More than 50% of people believe that ageism is common, and at least a quarter admit to treating people differently as they age. This is interesting because concerns about aging are very prevalent in this population. The survey highlights that ageism can have serious health impacts, with over 60% of respondents agreeing that discrimination affects people's mental as well as their physical health. And over 40% of Canadians believe ageism has a major negative impact on the economy as well. So there seems to be some awareness of what ageism is, what aging is about, but I think that there's a lot of opportunity to make a public awareness campaign to reframe societal views on aging. I will stop there, and over to you, Nicole. Happy to take any questions later about any of this. Thank you.
Thanks, Kiran. Yes, for all joining us, please put your questions in the chat. But thank you for those sobering observations from your practice, some beautiful metaphors about ageism, and some calls to action as well. So with that, I'm going to turn it over to Paula, who is going to share more from a gendered perspective on ageism, and then we will get into some questions. Thanks, Paula.
So thank you so much. It's a pleasure to be here and to be able to join this really important conversation. So I'm going to speak from Women's Age Lab, which is the first center to our knowledge that's focusing on issues that are important to older women, and really add sort of the gender piece to the conversation. So as you heard earlier on in this presentation, ageism, basically discrimination based on your age, was something that was a term that was coined back in the 1960s. It was Robert Butler who was the person who came up with that phrase and started talking about it. And I think you heard from Kiran today that it's something that we're now much more aware of, and from Laura as well. People are talking about it. But it took another 25 years, really, before the idea of thinking about the intersection with sexism, which is gendered ageism, discrimination based on not only your age, but also on your sex. And this is something really important to think about because as we've heard, ageism has very harmful effects, but this has particular effects on women who make up the majority of the older population. And it's something that I think we even don't recognize as well as the ageism piece. It's even things like, for example, talking about hair and gray hair. And when you think about that, we think of that as a sign of age. But for men, sometimes it's considered that perhaps they're becoming more distinguished. For women, it's considered something that is really a sign that they're getting older and something that they need to correct. And hence people, do things like dye their hair. So there's some important differences there that we need to think about. So I brought an image here to talk about gendered ageism, and maybe just to illustrate to you how it can actually play out for people and how it potentially impacts health. So if we look at this visual that we have here, If you think about people, older women today, so people like my mom, when they were young and they were finishing high school and going to their next steps, it was interesting that at that time, I think it's fair to say that a lot of women were not really encouraged or expected to go on and get higher education. They were often expected that they were going to work in the home. They weren't even expected to necessarily go into the workforce. But if they did go into the workforce, they often came in at a lower level, maybe because of less education. And I think it's fair to say that women have children and take time off, as they should, to raise their children. Women often didn't come back to the workforce or came back part-time. And maybe if they did later on in their career, they may have taken time off for caregiving responsibilities, perhaps for older members of their family. And as a result of these things, in general, women would have less career advancement, and over time would end up accumulating less in terms of lifetime earnings. And this leads to something that we've called ultimately the pension gap. So how does that impact people if you have less income or less pension? But it impacts you in a lot of different ways. So one is, I think you're less likely to be able to pay for help to come into your home if you want to stay in your home. Things are more expensive, and maybe in part that may explain why there's far more women in long-term care than men. That may be one of the contributing factor there. You're also less able to pay for things that might help you with your health and improving your health status, things that are potentially uninsured pieces. So for example, I think about glasses. I mean, many of us are wearing glasses. I'm wearing glasses. They're expensive, but without them, it's difficult to potentially function as well as you could. Or things like hearing aids that are needed to help you continue to be engaged in conversations. And also that can be helpful to combat things like social isolation. Perhaps with more financial resources, it's more easier for people to continue to be engaged or to engage in activities that require cost. And it may also relate to your ability to take advantage of some of the digital pieces that are out right now. Thinking about phones and computers and the ways people keep in touch are all expensive, and may also be something that perhaps may be difficult or more difficult for women. I mean, at the end of the day, what we know is that women have less financial resources than men, and there's a considerable pension gap around the world. This is something that happens not only in Canada, but in many, many different countries. And it's something that can go on to impact your health. So one example, perhaps, of how discrimination based on sex and ultimately age leads to things that actually impact health, especially for women. So something that we need to think about in some of our future conversations about what is it that we can do to address these kinds of issues. Thank you. Back to you.
Thank you so much, Paula. So beautifully articulated how discrimination can lead to, for example, financial repercussions, which leads to negative health outcome for older persons and often older women. And you've given us the perfect segue into some of our questions. So for our participants, we are going to go into a bit of a Q&A with our panelists. If you have questions, please put them in the chat now. We'll make sure to fold them in. But Paula, I'm going to pick up on where you just have left us on the unique experiences for older women. And I'm going to flip the question to Alyssa, if that's okay, and ask about, what strategies you think can help address disparities in the workplace, social, community, or other settings. Alyssa, particularly thinking about the life experiences and the unique impacts of ageism on older women.
Sure. Thanks for the question, Nicole. I think, at high level, we need to be taking an intersectional lens to policymaking and program design. So that means recognizing, all of the things that Paula has just walked us through in terms of how there are, distinct needs between various demographic groups within a population, and particular needs of women as a result of their experiences. Many levels of government, including the federal government, do take a gender-based approach and do a GBA or a GBA plus analysis in the policymaking context, which is which means that their policy proposals do need to assess the specific impact on women and gender diverse communities. So that's a great approach. That's something that we should all be adopting and thinking about in our work, and encouraging other levels of government to do as well. But it's not enough. I mean, we also need to be addressing the structural inequities that prevent women and older women in particular from reaching their full potential. So things like pay inequity, unequal distribution of household labor, and caregiving responsibilities. When it comes to the workforce in particular, there is quite a mismatch between the kind of work that's available and the kind of work that many older adults want to do, both in form and substance. And I think that it's fair to say that this impacts older women in particular disproportionately, given the caregiving responsibilities. So many older adults who want to continue working find themselves in a situation where employers really only think about work in sort of a full-time context. For example, the opportunities to do things like job share or work part-time are quite limiting. And so there's things that employers can be doing as well in terms of their practices and their approach to their labor force that would be quite beneficial, particularly to older women as well. So those are just a few ideas off the top.
That's great. Thank you. And Paula, I wanted to give you a moment to catch your breath after just kind of leaving us with some opening remarks. Let me put it back to you now. Is there anything that you would add or remark on from what Alyssa just shared, or build on in terms of strategies to help address some of these disparities caused by ageism?
Well, Alyssa, I think you touched on some really important points, and we could go on and on in terms of some of these things. But I think we just have to keep thinking about for example, in the workplace, what are the things that you could do differently? So for example, right now we have resources and support for younger people. For example, you mentioned caregiving, Alyssa, who maybe have caregiving responsibility often for children, which is great. But what about if you have caregiving responsibility later on for a parent or a relative or somebody who's older? How do we make that available as well for women? I mean, these are things that we need to think about. And then when we think about, for example, the reports that came out on addressing ageism, of course, one of the big strategies is thinking about intergenerational pieces. I think it'd be very valuable to have opportunities in the workplace for women who are older to be in touch more with the new workers coming in, the younger women, to talk about some of these issues and what they can do collectively to try to change things like the pension gap that I just described. What are the steps that you can take? I mean, for example, I'm not sure that younger women today are really aware of how these things can be important to you later in life, and so why it's important, if you're in a circumstance, for example, where there are pensions, to find out how to optimize that, and that it really does matter. So there's lots of things that I think we can do to help make a difference going forward.
Thank you. Thank you both. I'd like to go from the workplace to our healthcare systems. And so, Kiran, a question for you, please. How can the healthcare system confront ageism to ensure that older adults receive equitable, inclusive, and patient-centered care?
Well, thank you, Nicole. So what I'm about to say applies to ageism across all sectors, even though we're specifically talking about healthcare. As I said earlier, there are several ways that ageism manifests itself, expresses itself, and very importantly, what Paula and others have talked about is the intersectionality piece. So I work in mental health, and I see people with physical illness as well as mental health conditions, psychosocial disability. So that there's a huge overlap there. In fact, if you have access to journals, the American Journal of Geriatric Psychiatry of October 2021, which is a few months after the Ageism report came out, we actually published an entire supplement on ageism, mentalism, which is discrimination against older people with mental health conditions, and ableism, which is discrimination against people with disabilities, and other intersectionality. And we actually had 22 articles in there looking at every aspect of ageism. And just to give you some quick examples, healthcare is important, obviously, but gender inequality, as Paula has mentioned, work and employment, justice, housing and inclusive living, that includes nursing homes, by the way, elder abuse, huge issue that intersects with ageism, financial insecurity, transportation, lifelong learning, the digital divide, never forget climate change. So those are all covered in that one issue. And if you're going to read one piece, that would be one that I would highly recommend. So coming back to what can we do, there's really just three main buckets that we can look at. One, WHO has outlined this, education, and we're actually embarking based on all the mountains of data we have now to actually formally start an education program in Canada for every healthcare worker. And we've just put a grant submission in yesterday, actually. Laura helped with that as well. Secondly, we're going to be looking at some intergenerational partnerships. And third, we're influencing through Margaret Gillis and other people at this table as well. Alyssa is very, very much part of that, influencing governments to try and change the ageist policies and laws to affect better healthcare. We're trying to get in to see the Minister of Health and the Minister of Mental Health to help us change some of those laws. So really, to summarize what I've just said, to change large-scale social change requires very broad sector coordination. And through CCAA, we have several dozens of organizations now that are affiliate members or part of our CCAA. It's free. I've just put a link in, so please sign up. But it requires long-term commitment by a group of important actors from different sectors with a single common agenda to work at solving these complex social issues. So really, it's a collective effort which gives us the impact that we desire. If we all keep doing our own little thing and not work together, it'll never change. And last but not least, including older people at the table. And I'm really happy and proud that Olive is very much part of the work that we do, as well as we have a couple of other very good older persons who form our advisory group. So over to you, Nicole. I hope that helps.
That's great. Thank you. And I can't believe how quick our time is going by here. We're coming right up on the hour. So what I'm going to do for our panelists, I have one last question for each of you. And I'm going to ask you to just kind of respond in about a minute. And I actually want to end us looking at ageism and combating that inclusion in the digital world. This is a digital webinar. Our world is increasingly digital. So how can we foster inclusivity and confront ageism online? Alyssa, let me start with you.
Sure, thanks, Nicole. And it's a great question. We live in a digital world, so it's very important that we create digital spaces that are inclusive of older adults. So I think there's a few things to think about here, and I'll try to do this really quickly. First, I think we need to think about ensuring diversity and representation and counteracting stereotypes. So when featuring imagery or profiles of older adults, those should reflect the diversity of older adults, including gender, race, age, health status, ability, et cetera. But also older adults should be featured not only in stories that are specific to older adults like long-term care or retirement, but also in broad public interest stories about, for example, the workforce, about society in general, so that it demonstrates that older adults are vital members of our community. Secondly, I think we need to make sure older adults are part of the conversations that are happening online. And to do this, I think we need to do two things. Number one, our online spaces need to be accessible. So we need to think about accessibility standards, large text options, navigation, voice commands, etc. Older adults should be involved in the user testing for all of those accessibility standards as well. And I think promoting digital literacy is also really important. So that's something that we should be advocating for. And then finally, I think we can use digital platforms themselves to actively combat ageism through online awareness raising campaigns. And I'll give a quick shout out to the CCAA's online campaign that is running right now. I'll encourage everyone to reshare that on social media as well. And there's also a great opportunity to foster intergenerational interaction online through our digital platforms. And we know that that's a key component of combating ageism. So hopefully that was less than a minute.
Thanks, Alyssa. You covered a ton in a minute. Appreciate it. And I'm not going to take up any airtime. Paula, same question to you.
Well, this whole thing about the digital world is so important. But to me, it goes back to things like language. And I think there's so much that we need to think about in terms of how we speak about aging. And we mentioned earlier, the interpersonal piece and thinking about digital technology, sending messages to people, and making references to aging in sort of a way that therefore you must be getting confused or you must be awfully frail or things like that. We have to think about that. Is that really what we want to do? We need to change that. It also speaks to sort of just the general way that we talk about people who are old as assuming that they're all frail, which is clearly not the case, or presuming that people all need support. That's not the case at all. So we need to really change that and change the way also in thinking about digital technology. Sometimes there's images involved. What are the images that we're going to use to talk about aging? Because there's a great deal of diversity there that we need to be able to reflect. So it is really about changing these conversations. And it's not just individuals at an individual level, it's also at an institutional level. Because I think often using digital technology, we're using it in professional contexts. We're talking about it in things that we've written or published. And there too, far too often, we're using language that is no longer really considered to be person-centered or considered to be the appropriate language. So I think as organizations and as people part of societies and people who are publishing and doing these sorts of things, we too need to look very carefully at how we're using our language and start making some changes.
Thanks, Paula. And Kiran, last word on this question, over to you for a tight 1 minute, just so I can do wrap up and end on time for everyone.
Thank you, Nicole. I just want to finish off by saying that there are basically 4 different things that we need to focus on. One is looking at healthy aging. People have said in many ways, not every older person, it's such a heterogeneous group of people, it's so confusing, and we want to promote healthy aging. Second is enabling functional ability. People who are not doing well functionally can be supported through their environment, through various kinds of supports. Combating ageism is important. And lastly, addressing inequalities in every sector. And that includes gender-based and other sort of special populations like Indigenous populations, older women, prisoners, refugees, migrants, and so on. Because until then, we will leave people behind unless we do those 4 things. So thank you for that.
Thank you, Kiran, for those parting thoughts, which are just so fitting in general for this topic today. So I can't believe we've run out of time, everyone. I want to thank all of our attendees for joining us today. Thank you to each of you, our speakers, Laura, Olive, Alyssa, Paula, Kiran, for sharing so much with us today, for the generosity of your time. Thank you to the HelpAge Canada staff who made this webinar possible. Just a few quick notes before everyone jumps off. Please do sign up for the HelpAge Canada and CCAA newsletter. I understand that there's a new CCAA website that has just launched, Canadian Coalition Against Ageism. I think my team is going to put that link in the chat, so do check that out. And please follow all of the wonderful organizations who've been represented here today by leaders in this space on social media. And there will be our evaluation that's sent out tomorrow. We would love your feedback. So please, if you can take a minute for that as well, everyone who's joined us. But just one last big thank you to really everyone for being here today and for this important conversation.
Bye-bye. Thank you.
Thanks, everyone. Bye.
Thank you very much.
Thank you.
Bye-bye.
Thank you, and thank you to the HelpAge team.
Oh, thanks, Nicole. Bye, Raza. Thank you.
Bye-bye.
Thanks, Kiran.
Okay, great. I think we're good to end the recording in a minute too.